So we will learn about characteristic of agent, host and environment in health and disease. Any disease have an host, an agent and factor influencing the environment. So this host, agent and environment, these three is called epidemiological triad. Host, agent and environment. Everybody write down. So these three is called epidemiological triad. The agent is cause of the disease. And the host is organism harboring the disease. And the environment is external factors affecting exposure. It may be the biological, physical, chemical, nutritional and mechanical agent. So what are the non-living factors that can cause the disease?
So the non-living agents will be found. We can see within diseases of the unrelated diseases such as form, smoke, dust, and all. They can also cause diseases. Some function as well as objects and also.
Very good. Sit down. Like accident, RTA, burn. These are non-living, but that can cause the disease. Everybody written? So these are the examples of biological agents. Bacteria, virus, fungi, parasites. Those biological agents have characteristics. They have infectivity, pathogenicity, virulence and toxygenesis. So the host is a person or living organism that can be affected. The host factor determines the susceptibility or resistance. How? How the host factor determines the susceptibility and resistance? Suppose two persons, one has low immunity and one has high immunity. So obviously the disease will occur in the low immunity person. The host factors may be biological, behavioral and nutritional. Physical means heat, radiation, trauma, noise, pollution, and chemical, toxin, drugs, pollutants and heavy metals can cause disease. Environment is external condition that affects the health. हाँ मैं पूछ रहा हूँ एनवायरनमेंट कैसे डिजीज ट्रांसमिशन को सपोर्ट या इफेक्ट कर सकता है एनवायरनमेंट
कहीं भी क्लीननेस कम है तो डिजीजेस वहाँ पे फैलेंगी अगर साफ सुथरा एरिया है तो वहाँ डिजीजेस कम होंगे जैसे 12 कंट्रीज होते हैं ज़्यादातर वहाँ पे डिजीजेस कम होते हैं एज पर जो नॉन डेवलप्ड कंट्रीज में जो डेवलप हो रहे हैं
Very good. Sit down. So these are the types of environment agent, like physical, climate, geography, or housing condition. Just Kinshuk told how housing and poor sanitation can cause the disease. Biological agents like insects, animal. It has been seen that low income and low literacy rate countries have higher disease. So this is how interaction among the agent, host and environment. So take malaria as an example. The agent of malaria is Plasmodium. It may be Vivax falciparum. How many species of Plasmodium are there? 4. You tell. So for malaria, the agent is Plasmodium, the host is obviously the human, and environment is like stagnant water and mosquitoes. Stagnant water breeds the mosquitoes. You know now? So this is an example of coronary artery disease. The host is agent, genetic susceptibility. Agent may be cholesterol, hypertension, and environment is stress and diet increase the coronary heart disease. So what is web of causation? This represents the complex interrelationship between causes. like agent host environment. It helps to understand and prevention and control of strategies, identifying the risk factors, designing the public health interventions.